All right, folks, I've been given the green light to go ahead and get started. So I'm going to jump in, and I see a couple of folks introducing themselves on the chat. I love that. Please go ahead and introduce yourself. Tell us where you are and what kind of position you hold. I'm Dr. Rebecca Ritchie. It's nice to be here with you today. I have been asked by the Alliance to spend some time with you today talking about some motivational interviewing techniques. So I don't know if you were available and around over the last couple of weeks. About 2 weeks ago, we did a primer on motivational interviewing where we went over some of the little information that is supportive to today's advanced techniques. So let me introduce myself. Like I said, I'm Dr. Rebecca Ritchie. I'm a licensed clinical psychologist, a licensed clinical social worker, and an addictions counselor as well. And so I hold a lot of clinical roles. Right now, my main clinical role is working as a behavioral health professional in the Women's Integrated Services and Health Clinic at University Hospital here in Denver. So I work in primary care, specialty primary care, and work with a lot of women who just really across the lifespan. So lots of different stuff. So let's go ahead and jump into our slideshow. So for the first part of today's meeting, what you can expect is we'll kind of go through some of the materials. Then we're going to break up into breakout rooms and try some of the skills. Since this is a skills building workshop, I would love it if it could be more interactive, and feel free to ask questions. Feel free to jump in if there's something that you want to know. So without further ado, let me go ahead and bring up our PowerPoint for today. All right, so today we're talking about advanced motivational interviewing techniques for use with individuals who need screenings for cancers that are screenable. I know that most of you have probably been joining for some of the other educational webinars that have been part of the series, just about the different cancers and the screenings that go with them. And hopefully those have been helpful. And I hope that today's information is a good support to that information that you can take to your patient or client population, and will be usable in lots of different ways. So as you probably know, the mission of the Alliance is to reduce disparities in health outcomes and to foster ongoing health equity. And the purpose is really to support this development of a financially sustainable model for peer navigators and CHWs, PDSs, as well as promote the value such non-licensed professionals bring to population health and the healthcare delivery system. I know that we here rely on our peer navigators to do lots of really great stuff. And hopefully the motivational interviewing will be helpful for you in the screenable cancers arena. So here are the learning objectives. This is what I will really hope that we will learn by the end of our session today, which will be over with at 3:30, by the way. Well, I hope that participants will be able to identify at least these 3 advanced MI skills that we talk about today. I hope you'll be able to demonstrate the use of each skill. So when we go to our breakout rooms, we'll be doing some role play and some interaction in order to just kind of wrap our hands around some of these skills. And for participants to be able to outline ways each skill will be used in his or her practice. And so I kind of want to challenge you to start thinking about, as we go along, to start thinking about how you might use these skills and techniques with your own patient or client population. So let's go ahead and jump in. The first technique that we're going to be talking about today is the ruler technique. So this is an advanced technique because it really takes your conversation with folks to the next level, because I think it's the spirit of MI, the collaborative spirit, the together to figure out kind of where to go with a patient is, that heart set of MI is very, very important. And then when you add to it sort of this nuanced sort of means of assessment and really trying to tailor the MI approach to your individual, it just becomes so much more, I think, helpful for each individual person. So the rulers is an advanced technique where the first thing that you do is you think back to your stages of change model. And I know we just went over this in depth a couple of weeks ago, so I'm not going to go into it in a ton of depth, but I do want to just sort of reintroduce each of these stages of change, just in case it's been a minute since you've come across them. So pre-contemplative is a stage where people are not interested in talking about a change. Contemplative is the stage where people are definitely interested in talking about a change, but they're really hesitant. There's some ambivalence. They're sort of back and forth. Preparation is a stage where people have pretty much made their mind up that what they're going to do. They're just getting ready to do it, so they're expecting to change in the next 6 months. Action is where people are making the action. They're doing it and making it work. And then the maintenance phase is the phase after action where you sort of just fold that new change into your life. And so there are challenges at each phase, but it is really important that we are able to pretty quickly assess where people are in the stages of change. Because our MI skills that we use will be different depending on their stage of change. So another thing about stages of change that's really important is that they are fluid. They aren't crystallized. So maybe somebody will come to meet with you on a Tuesday and you'll think to yourself, man, this person is in preparation. They're definitely going to get that cancer screening that's really important to them. And then they might come back on Thursday and say, absolutely not, I'm not doing it. I don't even want to talk about it. So people can kind of jump back and forth about it. You also, might find the opposite, that somebody starts out pretty pre-contemplative about getting their cancer screenings completed, and then ends up in a contemplative or maybe even a preparation phase. So it's just important that you start every meeting with sort of an assessment of what stage of change they're in. So the readiness and the confidence to change rulers are what we call a scaling technique. And what a scaling technique means is that we're putting a numerical definition to their something that feels pretty subjective. So it puts their readiness to change on a continuum, like you see here, where 1 means definitely not ready to make a change, and 10 is like definitely ready to just jump in and make this change. So knowing where people are in terms of their readiness to change really, like I said, changes the way that you might speak with them about getting their cancer screening. So it doesn't have to be a readiness to change ruler. It can be confidence to change or importance to change. There are a few different ways you can kind of go about it, but we're going to start with readiness to change. So this one should be the one that you maybe use first if you're meeting with somebody for the first time, if you're just trying to figure out kind of where they're at in terms of how ready are they to make this change. So how do you talk to someone about a cancer screening when their readiness to change is at a 1 or a 2, pre-contemplation? So let's talk about this. So someone in pre-contemplation, like I said, might come to you and say, no way, I am not doing this today. And have some reasons maybe why that's why they're not going to get their cancer screening. So, somebody at pre-contemplation in that 3 to 6 range might come in and say, I know it's important, but that but is usually the indicator that it's someone who's struggling with some contemplative effort. If they say they're a 7 to 9, that preparation stage, it's going to be a lot different. And if a 10, they're in action, let's do it now. So what might you say that might be different to someone who's in pre-contemplation? So a lot of the time, people in pre-contemplation don't respond well to lots of MI techniques. If you start to ask some open-ended questions or even affirm them, sometimes that can be helpful. But most of the time, especially these 1 folks, they don't want to talk about it. They're not there to maybe talk about that issue. Maybe they're there to talk about something else. Maybe the cancer screening that you think is important is not important. Maybe the important to them, that is. Maybe there's some other reason why they're just not interested in having this discussion today. So For pre-contemplation, like I said, you can use some of your ORs, your open-ended questions, and some affirmations. But in general, for people in pre-contemplation, for readiness to change, it's really more about letting them know that your door is open for them in the future if they make a different decision. When people are at contemplation, this 3 to 6 stage, you can do a lot with folks who are in contemplation. If you think back to the stages or the different phases of MI, we can we've probably already engaged and focused. So if we're talking about doing some evoking with them, when folks let you know that they're in contemplation, that is the time to use all of your evoking skills. So they might say, I'm in contemplation, or I don't know if I want to get my lung cancer screening, say. And you can use all of your MI skills at this point in time, all of your ORs. You can ask open-ended questions. Tell me about why you're having some hesitation to get this lung cancer screening complete. You can, of course, affirm and summarize for folks, but definitely using that reflective listening is going to be key, part and parcel to your interaction with folks who are in that 3 to 6 range. So again, using your evoking, so thinking about those darn cats, the desire and ability, and just really listening for change talk, those little flowers of change talk, and using your ORs to really blossom those flowers. So um, 3 to 6 is kind of a great place to be when you're a helper with someone who maybe is just having some back and forth with themselves about whether or not they want to do the cancer screening that is necessary for them. And then 7 to 9, essentially in preparation, you would definitely affirm and support this person, definitely use a lot of reflective listening, but really, this person's ready to set a goal. They're ready to set a SMART goal. And so you can use all of your SMART goal techniques to help folks who are in preparation move to the next stage, which is action. And so when people say, hey, I'm at a 10, I'm ready to do this, then that's an indicator that they're probably ready for action. And in action, of course, you always want to affirm and listen reflectively. But people who are in action generally feel pretty good about their decisions, and so they might need a little bit of support along the way. But really, it's just that affirming and reflecting to them their own sort of emotions about what's going on. So let's talk about a different kind of ruler. This is the confidence for change ruler. So I always like to give the readiness for change ruler along with the confidence for change ruler. And sometimes I add the importance for change if it's a question. So the confidence for change ruler is just like the readiness for change ruler on a scale of 1 to 10. It's a scaling technique. And it's really just how you talk with somebody about colorectal screening or any kind of cancer screening when their confidence in change is at a 1 to 2. So again, these folks are not it's a different story when it comes to confidence than it does to readiness. And this is why I like to ask them together. A lot of times when you juxtaposition them for use with one another, then you get a lot of really great information. And so a lot of times when you do the readiness for change ruler, you will pick up on the strengths that that person has that will allow them to make this really positive health behavior change. And sometimes when you do the confidence for change ruler, you get to hear more about the barriers that they're experiencing. So if somebody has very low confidence, like I said, it's a different story. So where readiness to change, people in the 1 and 2 category felt like it wasn't maybe they weren't ready to change. Here, they just don't feel like they can. And so you very well, it's super common to get somebody who maybe is a 6 on the readiness to change ruler, but then a 2 on the confidence for change ruler. And so if you kind of think through what that situation might be, it's maybe somebody who's whose father passed away from lung cancer, and they know they need to get this lung cancer screening, but they don't have any transportation. They don't have a way to get to where they need to go. They don't, know that they can go through with the process. Maybe emotionally it would be difficult for them And so they might just feel like they can't really do it. And so whereas with the readiness to change, if somebody's in 1 or 2, you just kind of say, okay, I hear you. That makes sense. And let me know, down the road if you'd like to talk more about it. Someone that's in 1 and 2 for confidence is absolutely generally willing to discuss why that is. And you might get some really rich and helpful information about somebody listening to them talk about why they're not feeling confident about this change. And so they might tell you, my dad died of lung cancer. I just don't know that I can, be in a cancer facility. I don't know that I can go to a doctor's office and talk about lung cancer again. And then you can make some changes and some plans using MI to help that person maybe overcome some of those barriers. So 3 to 6 is low confidence. Again, just like with the readiness to change, you'd really explore a 3 to 6. You really want to know, why are you a 3? A technique I really like to use is asking people about the 2 points rule. So if somebody says, oh, I'm a 3 on confidence for change, I might say, oh, a 3, that's so interesting. I wonder why you're at a 3 and not a 1. And then they might tell you some strengths that they have. And then if you say, oh, and what about the other way? I wonder why you're at a 3. I wonder what could be different to put you at a 5. And you might hear some things that they consider as barriers for themselves. So if they're in the 3 to 6 area, you can definitely do the 2-point rule. You might get a lot of really great information. But again, just open-ended questioning, using that collaborative spirit, using reflective listening and affirmations. And then again, these are people who are in the contemplative stage, and so they usually respond pretty well to lots of evoking skills. So again, those darn cats, listening for change talk, trying to kind of draw out the change talk. Again, 7 to 9 confidence. These folks are in preparation for the most part. They feel like they can get it done, and so whereas readiness to change, if they're still kind of building that readiness and confidence for change, it would be really important for you to ask why they're at a 9 and not a 10. What's that last piece? And that last piece might be like, yeah, I don't have transportation, and all you have to do is help them figure out how to get there, but they're willing and they're ready and they feel confident that they can get it done. Couple of red flags, the things that are really important for you to know if you're going to use this technique. First of all, again, try to use them in juxtaposition just to get good information. But if you get people who say, I am a 10 in confidence and a 10 in readiness, then the next question is, I'm wondering why this hasn't been done then. So sometimes people think that their job is to tell us what we want to hear as helpers. And that's of course not helpful for us. And so kind of going out of your way to explore what that means for people. And letting them know that it's, that we're here to walk with them. We're not here to tell them what to do or how to do it. Also, if somebody has like a 10 for confidence and a 1 for readiness, or they're very low on readiness, then it's not a goal that is up front at this time, and it's probably taking a back seat to a different goal. And so you can ask, okay, what are you ready to do? Maybe they're not ready to get their prostate screening schedule, but they are willing to get their blood pressure checked, or maybe they are willing to talk about medication, or whatever else it is. So kind of exploring for people what that is. So here's an example. Maria and her children come to the clinic for a visit with a physician. She's not documented. She feels pretty unsafe talking to her doctor. So she refused her cancer screening despite a lot of risk factors. And the physician asked the peer navigator to intervene so that Maria can get the care she needs. And so in this example, the peer navigator uses a change ruler to help Maria out and says something along the lines of like, okay, Maria, it sounds like you're having some trouble trusting your doctor when she says you need to get a cancer screening. So on a scale of 1 to 10, how ready are you to get a cancer screening? And how confident are you that you can let yourself get screened today? So in the example, we don't really know how Maria answered, but if she is low on either ruler, you can use some MI techniques to help her make the best decision for her. Again, I know that we're all helpers and we want the best case, the best outcome for our folks, but um, we have to end up being okay with whatever decision that they make. And so, but we can help them make some decisions by helping them with their change talk for sure. All right, so let's move on. So that was number one. Number one was our rulers today. We're going to move on to the second skill that we're going to develop in our breakout rooms. And so the second skill is your decisional matrix. So let me just kind of walk you through what a decisional matrix is. And, if you think about a matrix and what that looks like, a decisional matrix is really just kind of a way of setting up dialogue to help people make decisions about the pros and cons of making the change at hand. And I think the major strength of a decisional balancing or decisional matrix is that it allows people to, there's a box that lets them outline the cons of making a change and the pros of not making a change. And so again, kind of harkening back to that idea that a lot of times people might think to tell us what they think we want to hear. Letting them know that we're not only open to having a discussion about why they might not want to change, but what's good about not changing. What are the benefits to you not getting your cancer screening? And we might be surprised to see what people come up with or to see what's important to them. One thing we won't necessarily touch on today, but I think is really important, is values. And so the decisional balance or the decisional matrix is a great spot for us to understand more about our patients or our clients' values. So we'll talk more um, about that in a little bit. But so decisional balancing asks people to kind of think through the pros and the cons in order to help them just understand their own ambivalence better. So I think a lot of times too, people are kind of embarrassed to talk about why they might not want to make a positive change. I think the quintessential example is sort of tobacco cessation because, in the last 50 or 60 years, it's become pretty widely known that tobacco is not good for you. But people who are tobacco dependent have a very difficult time quitting. And so, opening that door to listen to why they might not want to quit or, why they might not want to get their cancer screening will give you a window of opportunity to talk about some of their reasons why and also to help them with change talk. So when you do your decisional matrix, they can see that they're getting some benefits from their risky or unhealthy behaviors. And they will also maybe see that there could be some costs or consequences involved if they don't make this decision, this positive health decision. So these discussions are really meant to move people further along the readiness to change continuum. So this is a MI skill. You can piggyback off of the rulers that we just did. If somebody says, oh, I'm a 5 at readiness, and, you kind of go through and say, oh, I wonder why you're not a 3. And maybe they tell you, well, I was at a 3 until my best friend's dad died of colorectal cancer. And then if you would say, okay, and tell me what it would take to get you to a 7. And they said, I'd have to have a time off work and someone to watch my kids. And maybe somebody who speaks my language. I'd have to trust the person doing my cancer screening, any of those things. And then when they share those things with you, again, this is a really great place to pick up on values. So this person values family. They value, their work. They want to be sure they're conscientious. They want to be sure everything's covered before they take time for themselves. So picking up on that can be really helpful. So let's look at what this decisional balancing or matrix looks like. So here it is, just a little, little 4x4 square here. And you're looking at it and thinking, helping people kind of think through. And so we're going to come back to this after. So we'll read through the example and then we'll look at it on the decisional matrix. So Kenny comes to you. He's 49. He's a ranch hand and got kind of that cowboy mentality. He comes to the clinic because he has a GI concern, and maybe the provider has asked you to talk to him about his prostate cancer screening. Maybe they notice that Kenny's way behind on his prostate cancer screening. So he says he doesn't want to get screened because he doesn't trust the doctor. He also doesn't understand why he should get it fixed. And he said, if it's not broke, why fix it? But you know that that prostate cancer runs in his family and that it's a really big risk for him. Um, so the peer navigator might want to walk Kenny just through the decisional balance, and it doesn't have to be a huge ordeal, where you don't have to make a poster about it or anything, but just walking people through it is really, really helpful. So the peer navigator might say, well, Kenny, let's look at the pros of getting a screening, and now let's look at the cons of getting a screening. This last question is so, so, so important when you're doing a decisional matrix. It should really, I think, be attached to every decisional matrix, and this is which one feels more important. So after you do the boxes, you can kind of go back through and make decisions about which box is the most important one. So let me give you an example here. So here's our decisional balance. So the peer navigator might ask Kenny, so let's have a discussion about what's good about prostate cancer screening. And Kenny might be able to say, well, it would sure tell me if I'm going down the same path as my family. Definitely a pro. Also, young enough that he can still, um, engage in lots of different maybe options for treatment. And maybe a pro for getting his prostate cancer screening is that he can have information for his, children if he has any or whatnot. And he might, when you're walking through the pros for not getting this, again, this is when you're going to hear a lot about this person's values. And so, yeah, he might say, I don't have to take a day off work if I don't get screened. I don't have to alarm my family by telling them I have another doctor's appointment when they know my dad and brother have prostate cancer. I don't, I'd want to be screened by somebody that I trust. And so you can kind of pick up again on this person's values, that they value family, that they value their work, and that they, they're looking for a relationship that's collaborative. So, what the cons for changing is, a lot of times they kind of mirror diagonally, but you can talk about, so the cons for changing. So again, the con might be that he has to take a day off work, and you might have a time then to have a discussion about what that would take. Does he have to appeal to his boss 2 months in advance, 2 weeks in advance? Does he have a certain number of days he can take? Can he, add this onto another activity, whatever. And you can also then end on the cons for not changing, which is the place where you put a lot of those like potential challenges that might happen in their life if they don't make this decision. So they can kind of see it laid out in front of them. And a lot of times if it still doesn't feel, it doesn't pop out at the person what's most important, then sometimes I'll weight each of the boxes. So say, again, the pros for changing are that his cancer will be detected if it's present, and he'll be able to get treated. And maybe those are 10 out of 10 important to him. And so, this box might hold a weight of 10, an average weight of 10. But, he really doesn't want to take a day off work, although that's way less important to him than maybe actually knowing if he's sick. So maybe that's a 2, and, maybe alerting his family preemptively is a 4. Then this box maybe has a weight of 3, an average weight of 3. So in that way, you can kind of help people say, okay, well, there were more things and maybe the pros for not changing box, but the things in the for changing pros box felt more important to you. So we'll do an example together of the decisional balance matrix. So this is the third and final technique for today, asking permission. Asking permission is kind of a Psych 101 trick. Asking permission, it is a skill that really lets people have control over the conversation in a way that feels really good to them, and also lets them know that you are on their side. Even if their decision isn't what you would pick for them, this really lets people know that like you're in this together, you're in the same boat here. And so asking a client for permission before giving instruction or sharing also helps them understand that their opinion is valued. And, if some people do say no, like, I don't want you to say whatever it is that you want to say, but a lot of people are very curious. um, and so when you say, I have something to share with you, but I think it might be upsetting to hear. Would you like to hear it anyway? Once someone's given you permission, then you'll find that their defensiveness just sort of tanks. They've given you permission to say whatever it is you need to say. And so they don't feel defensive, even if it is, you're discussing the consequences of not getting a cancer screening, which to somebody, if you just walked up to somebody and said, I hear you don't want to get your cancer screening. What if you're sick and don't know it? It's important, and kind of start talking about again, the consequences. If they don't do it, they might get a little bit defensive, and be a little bit upset that you're sort of throwing all that at them. But if you ask them permission first, then they've given you permission. They've opened the door, and so a lot of times it really makes them feel a lot less defensive. So here are a couple examples. Can I have your permission to share with you some advice that's helped other women who aren't sure about getting their cervical cancer screening? This is one that I like to use a lot, especially in this clinic, because um, it's it's a pain, for some women, especially they've come to their appointment today, their annual, maybe they've already having to schedule their mammograms and maybe their colonoscopies, and to say, let's get your cervical cancer screening also. That's another appointment. Maybe you can't do it in the clinic. People are sort of reticent to kind of jump in and do all the things that they need to do for their health. But in talking to folks about this kind of decision, letting them know that this is common. People don't, maybe a lot of people have this understanding that, oh man, this is another day I have to take off work and another, setback or whatever it is. So this question both asks permission and also normalizes their experience, which is another MI skill, by letting them know that a lot of people that I've talked to have had the same issue. So, and then, would it be okay with you if we took some time to talk about the pros and cons of lung cancer screening? And so, again, people can and will say no, but in my experience, it's way, way less common than people saying like, oh, sure, just, kind of tell me what you have to say. And even if people say, it's not going to change my mind, but go ahead, you may be planting a seed for down the road. So it's still a positive. So here's an example. Sabrina comes to the clinic for tobacco cessation. Her peer navigator helping her suggested she get her lung cancer screening since she smoked for 35 years. And so the peer navigator might say something like, Sabrina, thank you so much for sharing all this information about your tobacco use. I really want to get your permission to tell you something you might find upsetting. And if she says, sure, go ahead and tell me what you think I might find upsetting, then it's perfectly acceptable to say, women who have smoked for 35 years struggle with, X, Y, and Z, and this is the best way to figure it out, just to kind of go into the information that's helpful with helping people get their cancer screenings. So after the peer navigator has Sabrina's permission, they can say, you smoked for 35 years, risk of cancer for lung cancer. I really recommend you get a lung cancer screening scheduled while you're here. How's that sound? So, so hopefully you can kind of see how asking permission, it really, it softens people. It really makes them feel heard and respected, and they feel empowered over the conversation at that point. Now, one thing I would definitely caution you against using this if you don't have a good relationship with somebody. If somebody just doesn't care for you, or if you had a negative experience with somebody, asking their permission might backfire. So they might just say, no, I don't care to hear what you have to say, or something along that realm. So asking permission really helps. It really helps if the person knows that you care about them. So now we're going to move, with the help of Taryn, we're going to move into some breakout groups where we're going to practice the 3 skills that we just were introduced to. the rulers and the matrix and asking permission. And so I think I'm going to pop into each of the breakout rooms bit by bit to kind of see how people are doing, make sure that there aren't any questions. And we're going to spend about 10 to 15 minutes having this discussion. So what you'll see on the next slide is a pretty big case consultation. And so you can kind of read about this case. And then the three of you together will talk about how best to use the rulers and the matrix and asking permission in this situation. We're back in the main room now. Welcome back. I was lucky enough to be a fly on the wall in both conversations, and just wanted to know if maybe one of you from each of the two breakout rooms wants to chime in just very briefly and tell us what your discussion was. So that's Jergwin and Asisco. Do one of you want to pop in and say what you came up with?
Okay, I can speak for Amanda.
Thanks.
So what we mainly spoke about was like in what order we were going to use the three skills, or we mainly were going to use our top two was going to be the readiness to change ruler, and then the asking permission. And for example, like for the asking permission, we were going to ask permission, we're going to ask the patient, we're going to ask Jackie if we could give her some advice and like educate her on a few things about the Medicaid coverage, because she was a little bit worried about using the Medicaid coverage because her two parents are undocumented. However, we were going to use that the ask permission skill to kind of inform her that, you know, her using the Medicaid for herself and her children is not going to affect her undocumented parents, just because they're not asking for any services themselves. And then Amanda came up with a really good idea. So with the readiness to change ruler, just because we wanted to boost the patient's confidence on you know, proceeding forward to have these services done. Amanda, you kind of explained it a little bit better. I don't know if you kind of want to jump in too.
Sorry, yeah. So we wanted to talk with Jackie a bit about kind of, instead of putting it on a scale of 1 to 10, putting it in a more time frame reference, like, okay, so if you're ready to get the scan done, would you want to get it done in the next year or in the next, you know, month, in the next 6 months or in the next week? And let her say kind of how soon she was ready to get that done, so that way we could get a better idea going for that, and using that as a reference point for her readiness, and then moving into that confidence. So then we could work with her for her child care for that, and we could ask permission if she was open to talking about, she had said she shared custody with her ex, and seeing if that was comfortable for her, for him to have the kids while she went for her screening, or if it would be better if she went at the same time that the kids were having their checkups, then they could go to the University and Children's Hospital, where they have the Creative Play Center, where the kids could be in their own care center while she went to the university to have her screening, so it was a safe and comfortable place. And so seeing where her insecurities were revolving around her psychosocial life.
I think that is so cool. What a good use of the ruler concept to kind of say, okay, you're not ready now, but are you ready in 3 months or 6 months, or do we need to looking at a year? So excellent job, very creative. I love it. Yeah, and I think that Jackie's got a lot going on, and her life isn't easy right now, and so helping her to kind of think logically about some of the barriers, and maybe even like using the decisional matrix to identify barriers, and then kind of talk about what if this wasn't a barrier? Like you said, what if you're using this cool thing at Children's where parents can drop off kids and then go do their own thing? And also giving her information about how her children's care won't affect her parents. Good job, guys. Great. What about Emily and Sylvia? Will one of you ring in real fast and kind of tell us what your discussion was like? Emily.
Organizational matrix as a way to point out, sort of like draw out the pros and cons of her getting cancer screening to help her be a better mom to her kids. Great. And then using that confidence ruler, because she has sort of indicated that she would like she's ready for the cancer screening if her kids, with the stipulation that her kids also are cared for first. So talking about how we make you more confident in your kids and in you getting care. And then Sylvia brought up a good point about asking for permission. And sometimes she shared one example in her work when she asked for permission to share more information or ask questions or whatever. And the woman said, well, you know what's right. So you should share it. You don't need to ask my permission.
Oh, wow. Okay.
Cool. I'd never heard that. So
excellent. I'm sorry, go ahead. Sylvia, anything else you want to add? Okay.
Sorry, I have a hard time with my my audio. So yeah, with the permission, I have different opinions because I've been asking the permission with the patients, and some patients get a little like a disappointed because I asking a permission. Like I don't need to do that. You know what you need to do. Is like they feeling because I asking how you feel because I try to be very respectful, and then we say, well, it feels like you don't know what you're doing. So so sometimes it's hard to know how the patient will be reacted. So I bring it up because I don't know if some people that happen already, but for me they happen like 5 or 6 times. So I'm open, I always ask how you feeling about it, why you answer, you say that, and they feeling like that if I asking is that I don't know what I'm doing.
That's so interesting. I'm glad you brought that up. What kind of population do you work with, Sylvia?
Denver Health, I think Spanish speakers most. And yes, I think I always say maybe 90% to the Spanish speaker. Like 4 people actually. There was a Spanish speaker only, and I think one that was in Larry. I think she was Caucasian. Yeah.
Okay, interesting. Well, that is an interesting perspective, and so if you know your population better than anybody else, and so if there's a technique that doesn't work for your folks, or if you feel that maybe it needs to be modified or used in specific situations, feel free to kind of modify it a little bit. Great job, everybody. Thank you for your participation in that. I really appreciate that. The last thing that I had scheduled for us to do was to participate in a little activity, and I'm going to reshare my screen so that you can see the activity, and then I'm not going to change it after that so that you can just continue to see the activity. So here we go. All right, so here's the activity. And so you do not have to share the results of this, but I would love it if we would take some kind of time and at least think through, and if you can kind of write some of it down, that can be really helpful too. But what I'd love for you to do is pick one health behavior change you think you might want to make in your own life. And once you've identified a behavior, place yourself on the readiness to change ruler as well as the confidence ruler. And then kind of do the 2-point question for yourself. Why did you choose that number? What would it take to raise that number by 2 points? And why do you think that number and not 2 below it? And kind of see if you can kind of tease out for yourself some of the strengths and barriers that you're experiencing around making that change. Also, you might surprise yourself where you end up on your identified behavior, on your confidence and your readiness to change ruler. So, and then use the decisional matrix to try to evaluate your own ambivalence to change and see if you can kind of complete those pros and cons columns, and see if you can notice anything about your ambivalence. And so, like I said, you don't have to share, but if you want to share your activity after it's over, then that will be wonderful. But let's take a couple minutes and kind of think through some of these before we come back together to discuss. I'm going to play along and do it too. All right, folks, let's just have about 1 more minute and then we'll come together to discuss. All right, so hopefully you got a chance to kind of get through your own behavioral change. Does anybody feel brave and want to share their health behavior change they want to make and their responses?
Sure.
Good.
This is Sylvia. Okay. I think I wanted go back and doing exercise. I'm lack exercise right now. and I was diagnosed of high diabetes, and then I was exercise, and I came down completely with not even pre-diabetes, and now I lack exercise again, and I don't know how I can go back. So that's my story.
Excellent. Good. And so when you put yourself on that confidence ruler and the readiness ruler, what did you find?
um, I am in the 5 right now because I think I'm lack of motivation.
Yeah.
When completely lack of motivation. When I try to put it 2 point down, um, I would say I put a 5 because not two, not 3, because I care about my health.
Mm, good.
So that's why I pick in the middle, try to find the motivation. And then when I use the metric, uh, when I evaluated that, the pro and contra, I make a list of the pro. And when I notice is that the pro is more on the post. A pro is a cost. Sorry.
Yeah, good. And so when you came up with this is your result that there's more pros than cons.
Mm-hmm.
Does that help motivate you?
Yeah, actually, yeah, because the cost is it's not that bad. Actually, I can. I was feeling like I was bringing solution right away to my brain.
Yeah, good. And so kind of slowing down, taking a chance to think through it, that sounds like it was helpful.
Yeah, yeah.
Excellent. Good. Thank you so much for sharing. Anybody else care to chime in?
I can share mine. This is
Okay.
Jennifer.
Hey, Jennifer.
So mine was walk for 30 minutes during lunch. And then once the number that I wanted to give myself was probably a 4.
Okay. Yeah.
And it was just because, again, like Sylvia, the motivation is low, and I don't really know like all of the pros. Like I know that it's good to go walk, but I don't really know like what health benefits I'll gain from walking 30 minutes a day, or if there are even any. And then also I just came up with an excuse that the weather is changing and it's going to get cold out and it might snow soon and I can't go outside. And then, so then what it would take to raise that number by 2, I thought maybe either like maybe having a walking buddy with me, because I know some coworkers that go do the walking, or bring running shoes to work so I feel comfortable when I'm walking. And then maybe a self-pep talk just to motivate myself a little bit more.
Excellent.
And then why do you think you picked that number and it's not below 2, not 2 below it? And I just think I didn't pick 2 on the scale just because I really want to just start walking a little bit more. And then with the pros and cons, like Sylvia, I just know that I know that not walking is also not good for me, so why would it hurt to go for a walk for 30 minutes when I have 60 minutes of lunch? And then I don't want my muscles to atrophy because I sit all day.
Absolutely. I totally hear that. Good. Excellent. And so what did you notice about your motivation level after completing the exercises?
That it just seems silly not to do it just because of motivation. Like I feel like once I get started, then I might have motivation to keep going
Yeah.
or to do it more. Yeah.
Makes total sense. Good. Well, good. Thank you so much for sharing. Mine was very similar to yours, Jennifer. So I have a lovely dog who gets very little exercise, but he needs it really badly. So when he doesn't get it, he eats things that he shouldn't eat. So I felt like I'm pretty confident I can make this change if I want to, but I just feel 5 on readiness. Um, but after doing my decisional matrix, and thinking to myself that it was about his health and the quality of his life, then it's yeah, just exactly like you just said, Jennifer. Why wouldn't I do this? What could be more important than my pup's health and safety? So by doing this activity, we can kind of see how it helps people move them along, and think about, again, which column's most important. So my health and not having to walk in the snow and not having to go out for a walk at night after I get home from work. All of that sounds really lovely, but what's most important is his health and safety. So um, excellent job, everybody. So what I'd like to do is to give you an opportunity to share how you will use change rulers, decisional matrix, or asking permission in your practice, or to ask any questions about anything that we talked about today.
It's Jennifer again. I honestly, Dr. Rebecca, I really actually enjoyed this course a lot.
Oh, good.
Like it was, yeah, no, I really think it was very useful. I will definitely, I feel like I gained a lot of like the verbiage from this, and then also I can see how I can, I guess, because sometimes I feel like I have the right knowledge to persuade people into doing, like, because I do colorectal, like, well, the colorectal screenings, but sometimes it's like I just don't know how to speak to them so that information can come out clearly, or how I can kind of, make them notice that some of these screenings are actually like are more important, or can just overcome all of the barriers that they're running into, and not just motivation, but also like other things, like these are actually really important things to have done regardless of whatever is keeping them from doing them, if that makes sense.
Yeah, absolutely. And I think we all have that experience, the one you're saying you're trying to avoid, where maybe a healthcare worker just tries to maybe like push, and say like, but don't you understand it's bad for you if you don't do this? And it comes from a good place, but a lot of times people sort of, they don't love that. So finding a way to kind of say, this is important, and let's talk about where you're coming from with it. Maybe it could be helpful. Good. I'm so glad you enjoyed it. Thank you for sharing. I appreciate that.
Yeah, I agree. I agree with that too. And let me tell you that sometimes I even using these tools that I've been learning from you guys to my 12 years old boy. So thank you.
So funny. That's
Make my
excellent.
life easy.
Sometimes I'll tell people when I'm doing MI training to try it on your spouse and see how it goes. I don't know that I would suggest trying these things exactly on your spouse, but try ORs on your spouse, and it's amazing.
Yeah.
Dr. Ritchie, this is Amanda. I actually really appreciate, especially the decisional matrix. For myself, I work in ocular melanoma and rare cancer space. And what I've found is using this, even in treatment conversations with patients, has been really helpful. In our kind of subspecialty, when you're talking to patients about things like this and deciding which round of treatment or what kind of path they're going to go down, this has been super helpful in letting people feel empowered and making their own health decisions and just feeling that self-efficacy. So I appreciate that, and I found that the more I empower my patients to make their own thoughtful, informed decisions, the more they're doing that for their family members and their friends and their children, and it kind of spreads throughout.
That's awesome. You get an MI ripple.
Yes, exactly.
Excellent. Well, excellent. Good. So I'm so happy that we got to spend this time together today. So and thank you all for sharing and for interacting and for the feedback. I'll be doing another one of these, I think, in 3 weeks on the 5th of November with just 3 different MI skills, advanced MI skills. So hopefully I'll see you there. And if you come, hopefully you feel as interactive as we ended up being today. So if there aren't any questions, then I'll stick around for a couple minutes in case you have any. But I think we've come to the end of our discussion today. Thanks, everybody.
Thank you. So the next one will be the 12th, right?
I think it's the 5th.
5th.
Hang on a second. Let me just check for you real
The
fast.
25th.
Yeah,
Yeah,
it's
please.
November 5th.
November 5th. Okay, yeah.
The November 5th. Okay, thank you.
Thank you.
Thank you.
Thank you so much.
Thank you.
Yeah, thank you. I actually just want to point out also, like, everything was, I like that you gave us like the hard scenarios, and then also because it just felt like more real, because some of the other things I feel like it was just like easy barrier, and so like I would always be confused on like how we would use it. So thank you for making it making them kind of very complex patient scenarios, and then also it was very clear. So thank you for that. I just wanted to give you that.
Thank you. I really appreciate that feedback. That's so nice of you. Where are you? Where do you work?
I work at the Stride Clinic.
Oh, cool. Very cool.
Yeah, we're here in Wheat Ridge. So yeah, thank you so much. It's very valuable information. I appreciate it.
Excellent. Thank you, Jennifer. You have a good day.
Have a good day. Thank you too. Bye.
I have a quick question for you.
Yes, ma'am.
So the one on November 5th, is that information going to be building off of this webinar?
In a way, it kind of all goes together. So I just picked out 6 advanced MI skills. And so, you know, it kind of builds off it, but if somebody needs to come in cold, they won't be super confused.
Okay, because it looked like a lot of I was getting a lot of emails from people, or not a lot. It was 2 different people that were emailing me that took the test and didn't receive like any information for the Zoom link, and it looks like their emails bounced from our
Oh, no.
Gmail account, so that's why they didn't get any of the information.
I see.
So I was wondering, it's still okay for them to do the one on November 5th?
Absolutely. Yeah.
Okay.
Yep. The biggest thing is that they have some sort of MI knowledge before where they jump in, kind of.
Yeah. Okay.
Awesome. All right. Thank you so much for your help today.
Oh yeah, no worries. And yeah, this is recorded, and we'll post it on the website.
Sounds perfect.
Alrighty.
All right. Thanks, Taryn.
Have a good day.
You too. Bye.